Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. This is ITV Networks channel 347, and remember you can catch us as well on our YouTube channel Health Matters. I'll be with you for the next hour or so as we commemorate the 28th of July World Hepatitis Day. We find out more about that today with our in-studio guests and specialists. Of course, we start with our medical in-house specialist, Dr. Wadi, nephrologist, as well as Dr. Bilal Bobat, our hepatologist. Did I get that right? And you said / gastroenterologist. Thank you very much. Assalamu alaikum and welcome to the show. So before we start with hepatitis, what exactly it is, Dr. Wadi, you kick off the show, inshallah, and just give us a brief of that, inshallah.
So alhamdulillah, we obviously there's a lot of advances in our understanding of disease over the centuries and decades. So one of the things that was quite difficult to diagnose, and took quite a long time actually, and in fact, the definition of how these conditions or what was causing these conditions was quite late on compared to many other conditions. And these are infections of the liver by viruses. Now, the liver is quite susceptible because it gets a large amount of blood. And then the blood comes from the GI tract, a lot of it. So things which come into your gastrointestinal tract can find their way into the liver. So many liver viruses or other infections can get it from the gastrointestinal tract. And because it gets a lot of blood, can also from the bloodstream. But the manifestation is of jaundice, feeling unwell. And then obviously if the liver completely fails, it can lead to death. So it was really not easy to understand what causes these conditions. And many of them I identified sort of in one by one. So, for example, they identify and then they call it hepatitis. And hepatologists, with respect to Dr. Bawat, are very sort of creative. So they call it hepatitis A. Then they identified the next one. They thought, what comes after A? They went for B. So
I'm sure he wasn't around back then when
I
they
don't
decided
think it was,
to do that.
Now it would probably have a different name, Bobat hepatitis.
Okay.
But it's I think that's the sort of history. And then they discovered another hepatitis. They didn't know what to call it. They said, okay, it's not A and not B. So they call it hepatitis non-A, non-B. Then they identified the virus. They call it hepatitis C, and so on and so on.
Yeah.
And we're still discovering viruses which cause hepatitis, some of which we thought cause only other conditions, and then we realized they also cause hepatitis, So I think that's
and
the
hopefully
background.
they're not going to take up the whole alphabet. They'll find better names, inshallah.
Inshallah, yeah.
But yes, just as a bit of history, shukran so much for that. But let's get into what exactly hepatitis is, Dr. Bilal.
So hepatitis is a general inflammation of the liver. If you break up, a lot of our medical terms are based in Latin. Hepa would be the liver, and itis is inflammation of. So hepatitis is inflammation of the liver, and it can be from a number of causes, the most common of which would be viral. As Shoaib has mentioned, viral hepatitis A, B, and C are some of the more common viruses. But there are other viruses, and we have gotten more creative with the names.
But you're up to about G now. How far are you guys?
Really? I thought there was only up until E. Okay,
No,
but we'll get into...
more, yeah.
Is there more? Okay. So understanding what hepatitis is and what the causes is, what could you say to a layperson? Besides the fact that your liver is inflamed.
So your liver is inflamed, and how that then shows up on an individual. Some hepatitis is barely noticeable. It's like with many viruses, it depends on how the body reacts to the virus. Sometimes the immune response can take care of the virus without exhibiting outward illness. And at other times, it can be quite a vigorous response causing damage to the liver especially, and then the patient can manifest with signs and symptoms. Now, some of the symptoms that the patient can complain of would be nausea, abdominal pain, and it's generally in the right upper part of the abdomen, just under the ribs.
Is that where the liver is?
That's then where the liver is located, and that's because of...
So your right part's under the ribs?
Just the upper abdomen, just under where the ribs are ending. And that's due to stretch of the liver capsule as the liver enlarges because it's inflamed. The most common sign that people notice is yellowing of the eyes, and often it's other people noticing it for them rather than them seeing it in the mirror. Darkening of the urine, pale stools, itchy skin, and feeling fatigued or lethargic. Some patients can manifest also with a fever. All right. In terms of the signs that the doctor will then pick up, as I've mentioned already, is the jaundice.
Yellow.
They can, when palpating the abdomen, they can possibly feel an enlarged liver. There may be lymph nodes that would be detected. And then it depends on whether or not this jaundice or this hepatitis is acute or chronic.
Okay.
Some viruses can lead to chronic hepatitis, and that then can lead to a number of other features, because over time you can lead to chronic liver disease and liver damage through inflammation, which then can lead to cirrhosis.
Okay, so Dr. Weddy, looking at the sort of symptoms, and I'm sure you've got some patients with also liver issues, and yellow being the main thing that we always recognize. Is that one of the first symptoms? Is it quite acute at that time?
So I think
what would be presenting?
So I think for the jaundice or the yellow eyes can occur in patients who have acute hepatitis, but can also be a feature of people who've had hepatitis for a long time where the liver is badly damaged. But it's not only hepatitis that causes jaundice, although that's one of the sort of classic signs. I think in many people, especially if it's a viral hepatitis, it starts like almost any other viral illness with a prodromal period where you just feel unwell, may have muscle pains, fatigue. And fatigue is a really big feature of acute viral hepatitis. The patients feel extremely exhausted.
And tired for a long time?
Well, it depends. Depending on the type of hepatitis, they can be exhausted for months after it, yes.
So presenting first is a big thing, is the tiredness, continued tired. Would it be throughout the day? Because now you need to check, I'm not necessarily that they got hepatitis, but listen, I'm just feeling very tired, fatigued, and the first port of call you do is visit your GP.
Yeah, I mean, it's not normal tiredness like, you had a long day and you come home and you have to be on health matters. It's like exhaustion, you can't get yourself out of the bed.
You look good for tired, Dr.
Alhamdulillah.
Alhamdulillah. So is a complete drainage of everything you feel?
So, tired wouldn't be the only symptom
Okay.
that you're presenting with. It would be with other things, and things would move along in terms of the presentation.
It will progress then.
Yeah.
Okay.
So,
Quickly.
I don't think we're looking for people that are just tired to go
they'll
get
be
screened
full tomorrow.
Exactly. So combination.
Yeah. So it's a number of things that would happen in constellation that would give us the idea to say maybe we should check the liver function tests on bloods, and then maybe screen for viral hepatitis if those are abnormal.
Okay, so
just to take a step back, I know we're concentrating on viral hepatitis, but hepatitis, the syndrome of swelling or inflammation in the liver, can be caused by quite a lot of other things besides viruses.
Okay.
Some of which may become more common as viral hepatitis becomes less common because of vaccination and so forth. So maybe Bilal can give us some
what else
information.
causes it?
So, like I said, hepatitis is just general inflammation of the liver, and there are a number of things that can cause this. Even when you take a drug that can react with the liver, and you get a drug-induced liver injury, you get a hepatitis from that. Certain autoimmune diseases, you get a hepatitis. Toxins, most commonly, one of which would be alcohol.
Okay.
You get a alcohol-induced hepatitis, which is very difficult to treat. So yeah, I mean, even things that you wouldn't necessarily consider, like sunstroke. One of the features of sunstroke, patients get a hepatitis.
Interesting.
So inflammation of the liver, viral hepatitis, yes, is common, but is not the only thing.
Okay, and it definitely doesn't sound like it's hereditary.
Well,
Yeah.
Okay, that wasn't even in here.
So you can inherit hepatitis. So viral hepatitis can pass from mother to infant.
Baby, okay.
So in fact,
Fetus.
it may be quite a common way that hepatitis B was spread in South Africa. And South Africa has got areas which are what we call endemic for hepatitis B. That means there's a large percentage of the population living their lives, their entire life sometimes, with hepatitis. So for example, the Eastern Cape, it is the Eastern Cape, was one of the most endemic areas in South Africa with one of the highest incidences of hepatitis B in the world.
And then additionally in the northern parts of South Africa, the northern parts of the northwest province stretching into Limpopo, northern Mpumalanga, and very much so in Mozambique. You have very high prevalences, up to 16% of the population in those areas can be chronically carrying the hepatitis B virus.
And many of these got it from their mothers or in childhood.
Okay.
Now this is not necessarily where they'll have a hepatitis because the virus is there, but then the immune system isn't necessarily attacking the virus, and therefore the liver isn't getting inflamed.
They're living with the virus.
Yeah.
Okay, let's talk about how they are actually living and diagnosed in all of that, known or unknown. Just after the short break, we speak to specialist hepatologist and nephrologist in studio with us. And remember, this isn't a live show, but you can interact with us via our YouTube channel and contact our offices for any questions, comments and queries that you'd like to add to Health Matters. A big thank you also to the IMA for the production and adding value to the show. We'll be back just after this. Assalamu alaikum and welcome back as we highlight the 28th of July World Hepatitis Day. So just an interesting fact, hepatitis on the 28th of July was chosen because of the birthday of the Nobel Prize winning scientist Dr. Baruch, hope I'm saying that right, Bloomberg. This gentleman discovered hepatitis B virus, the HBV, and developed a diagnostic test and vaccine for the virus. So that's where hepatitis name came from. So if you didn't know, Dr. Baruch Bloomberg made history, and I'm sure you guys did some work with it, with what he developed as well. So into where the hepatitis has grown and developed, and understanding it is something that a lot of people are still walking around undiagnosed. So let's quickly unpack that. How is diagnosis done for those that are presented, that go to their GP with all these symptoms, and for those that do not, and how dangerous that is?
It may be prudent to just split it up into maybe the three common hepatitis, and we can start with hepatitis A, which may be the simplest.
All right, so they get diagnosed differently.
Okay, so hepatitis A is generally diagnosed in childhood. The transmission mechanisms for each virus is somewhat different.
Okay.
Hepatitis A is picked up often when young children start attending play school or creche, where, like I'd said earlier, sometimes you won't even necessarily pick up that the child is necessarily ill because it'll be just like almost like a flu-like type sensation, and it passes. It ranges from relatively asymptomatic all the way through to fulminant liver failure. Okay. All right, where the child can present can progress in terms of the hepatitis to the point that the liver in its entirety is destroyed by the virus, and
quickly
the child needs a liver transplant in order to survive.
Sure.
This is something that we see at our center at the Fitz-Donald Gordon Medical Center, because we also do living donor liver transplants. So here we're able to take a piece of the mother's liver and save the child's life, mother or father.
So this is specifically hepatitis A and fixed children?
Any form of fulminant liver failure.
Okay.
But the point is, hepatitis A is usually an acute condition.
Okay.
It doesn't cause chronic hepatitis.
Yeah.
And I think what Bilal mentioned is the majority of people who pick up hepatitis A, which you actually pick up, it's called fecal oral. So you pick it up from food, which is contaminated, usually by poor hand washing or by fecal matter or so forth, which is common. And I don't know, Bilal may want to tell you how many people in South Africa are likely to have had hepatitis A in the past.
Yes, please do, because I think, you know,
Or
today,
be
today's
exposed to hepatitis A.
day and age, you want to be careful.
Most people
what
are
you-
actually,
majority.
I don't actually have an exact figure for you, but the vast majority of people would have been exposed at some point.
In their life.
Because, you know, we're not talking about your hands are messed and you may go eat something. It's someone who may very well have gone to the bathroom, washed their hands, but the virus still remains on their
And then
hands.
they shook your hand.
And then they've shaken your hand, or they've prepared you a meal. And, you know, for instance, a salad or something. Now, when adults contract hepatitis A, the disease is often a bit more
It's much more severe.
They present with the full spectrum of illness. And hepatitis A, although there is no specific treatment for it, generally runs a course that settles. It's not that common that we have to transplant adults for hepatitis A.
So you're just talking about poor hygiene, going to the toilet and not cleaning yourself, your
Well
hands
enough.
rather, and coming and spreading it
Yes,
that way.
but not just that, it's making sure your food is washed properly. So food hygiene. So hepatitis A is prevented by food hygiene. So that's why the risk of contracting hepatitis A is much higher in areas where there's lots of people doing, like if you go for Hajj, for example, or if you go to the subcontinent or a third world country, which South Africa is an example of.
Yeah.
So, for example, travelers are advised to be, from first world countries, are advised to be vaccinated against hepatitis A when they travel to the third world.
Or if you like eating out.
Yes.
If you like eating out and you like
Be
having
choosy.
But
some salad.
You can test if you've been exposed.
And how can you do
It's a
that?
blood test.
Okay.
And
So you're saying you shook somebody's hand, okay, before, we're not talking about the food now, but that transfer, and you go and wash your hands and then it's gone.
No. You may have been exposed to it, and then you had a mild version of hepatitis A. Maybe you didn't even know, you thought you had a flu. And this is often in childhood.
Yeah.
You have a bit of a fever, feel unwell, maybe vomit a bit, and then it gets better. But then after that, you are immune to hepatitis A.
Oh,
That's the good.
without having a vaccine.
Yes.
But if
you had to have the
have
disease.
never been exposed to hepatitis A,
Yeah.
then I would advise people to take the
Take the
vaccine.
vaccine. Even if, for example, if you were going for Hajj, it may be late for the Hajjis now, but it's one of the vaccines which is recommended, not compulsory, but recommended if you have
Okay.
it, and you can check whether
So
you've been
just
exposed to
a pop-up
hepatitis A.
question, if you've been exposed, you go for the blood test, and now as a specialist saying that listen, you are actually vaccinated, do you then still recommend it to go for a vaccine? No. Okay.
General, if
And that's
you-
your proof.
If you are immune.
Yeah.
Then you're immune.
Yeah.
Okay. Hepatitis A.
That's just one hepatitis.
Hepatitis B.
Let's go to B.
Let's go to B.
So
B
now
and not to
hepatitis B is one of
The HPV, Dr. Baruch Blomberg.
That's
Yes.
it. All right.
Much more complex.
It's a bit more
Okay, that's why his name
complex.
stands out.
Yeah. It was first identified, as you pointed out, in the 70s. It was initially called the Australia antigen because Baruch Bloomberg is an Australian. The virus is common pretty much throughout the world, but you have certain hotspots. Now, Southern Africa is one of those hotspots, and then
For?
Asia for hepatitis B.
B,
As we
okay.
mentioned earlier.
Okay, just checking.
For hepatitis B. And then moving up into Asia, the subcontinent, China and Taiwan, where we
Okay.
have very high rates of transmission. In South Africa, the commonest mode of transmission is still mother to child. This is where the mother would have a high viral load when she's giving birth to the child, and it can transmit. Hepatitis B and HIV have very similar transmission modes, so it's also transmitted sexually via blood, but hepatitis B is 100 times more infectious than HIV.
It's one of the most infectious viruses
So you
we
need
know.
And so how is that spread? The same way?
so the same way
Like
as
HIV.
HIV, right?
Okay.
Through blood, a contaminated blood product, through sexual intercourse,
and mother to child.
Saliva.
But that's the difference between HIV and hepatitis B. So HIV, you probably can't get it from saliva.
Okay.
But hepatitis B, there have been reports, especially in young kids, for example, of spreading through other bodily fluids like saliva and so forth and so on. So, and it's thought that some of the spread, that the horizontal spread in young kids may be through other bodily fluids, because they're all together in a crash. And
I can't think off the cuff now if my kids
spitting and vomiting
needed
all
to
over
be
each other.
vaccinated for hepatitis.
Well, are they born in South Africa?
Yes.
They will
They
have
would,
been
okay.
vaccinated.
So the good news is that then the vaccine came available in South Africa in about 1995. So if your children were born after 1995,
It became compulsory.
Okay.
yeah, it entered into the expanded immunization protocol.
Okay.
All right. So 1995, however, our compliance to that protocol is still not 100%, especially in the rural areas where we probably need hepatitis B vaccine coverage the most.
Okay.
So that's still a work in progress. There are ways, if you are pregnant and you have been screened for hepatitis B and know that you have it, to prevent transmission to your child. And this would entail taking medication, antivirals, to suppress the viral load. Hepatitis B at this moment still cannot be cured. So it suppresses the viral load, and then there's a certain protocol to be followed as soon as the baby's delivered in terms of giving it immunoglobulin or antibodies against hepatitis B as soon as it's born.
And this is
the
medication.
vaccine. And this is medication. This would then stop the baby from developing hepatitis B.
Because when the baby is born, it's exposed to a lot of the mother's bodily fluids, besides when it's in the placenta, and hepatitis B can cross into the placenta.
So quick question on the baby now, and babies that are born with jaundice. Do doctors worry that hepatitis presents?
Generally not, because these are, there's a specific reason for this. This sort of jaundice is because the breakdown of fetal hemoglobin, or the hemoglobin that occurs in the womb, to adult hemoglobin, and that switchover is happening.
And the type of bilirubin, you can measure it in the blood.
Yeah.
So it's a different type of bilirubin.
Okay, I just wanted to clear that for any moms
But,
with
let's
phobias.
if we unpack hepatitis B, so you can have acute hepatitis B, just like hepatitis A. That means you get hepatitis B and you get severe acute hepatitis B, which can damage the liver severely and acutely, or can be mild, and your body can clear it. So there's a significant percentage of patients, I think about 2/3, I may be wrong, will clear the hepatitis from their body. The immune system will clear it. They'll be cured and they'll become immune to hepatitis B. That means they won't be carrying it.
Okay.
It'll be gone from their body. But there's a significant number of people who will have ongoing hepatitis B infection. Some who will have ongoing inflammation with the hepatitis B, and others will just be carrying it, so for carriers. But they both have implications.
So the vaccine just covers hepatitis B.
It prevents hepatitis B
It prevents hepatitis.
if you have not had it before.
Okay. Not hepatitis A, and we still
No,
not
there's a
get to
separate vaccine for hepatitis A.
Oh, is there?
And there's a separate one for hepatitis B.
that. Okay.
However, there is
Sure.
a combination vaccine as well.
Is it? Okay. Good.
So you only
Thank
need
goodness.
one injection.
One
injection,
injection. Okay, and we get it. It's available. Yeah.
It's available.
That's what the Hujaj would maybe take. Before
Yeah,
they go.
well, most of the Hujjaj should be, the risk of hepatitis B would be small, and most of them currently now would probably have been vaccinated already. They're in their 20s and
Yeah.
mid-20s.
And then can you be vaccinated at any time in your life?
Yes.
Sorry, you were going to say something, Dr.
So just in terms of what Shuaib was talking about in terms of your risk,
Yeah.
the adult risk of the hepatitis B staying with you is about 10 to 15%. Most adults, because we have a fully developed immune system, clear the virus. That figure is the exact opposite, and this is what drives South Africa's epidemic of hepatitis B, is that when you're a child, your immune system still hasn't fully developed. And therefore, the hepatitis B cleverly tricks the infant into thinking that it's not a problem. And therefore, it stays.
You live with it.
You live with it.
So
And
there's
that,
no signs that you could possibly You go to the
Often
GB,
none.
you're having a flu, and say,
No,
listen,
so that if you're
check me for hepatitis, check
if
my
you're a
children.
carrier for hepatitis B,
Yeah.
there can be nothing. It's only if someone specifically looks for it.
Now, this is important for individuals with a family history of liver disease.
Okay.
That they may not be aware exactly what happened, should get checked for hepatitis B. Hepatitis B now is one of the big causes for liver cancer in South Africa. And these young individuals that contract the virus at a young age, even though the virus may not be causing inflammation in the liver, hepatitis B is called an oncovirus. Onco meaning cancer.
Cancer, yeah.
It causes cancer, right? Because it integrates itself into your DNA, and by various manipulations within the cell can result eventually. Now, what happens in Southern Africa is that we have hepatitis B induced cancers occurring in young individuals, and I'm talking about in their late 20s and early 30s, as the first sign of the fact that they've had hepatitis B.
So they were living with it, thinking, not knowing it was there, but it's not harmless.
So that kind of cancels my question, does it cause cancer? We're going to
causes
talk
cancer.
more on who is at risk besides liver patients and history of liver damage just after this World Hepatitis Day, 28th of July, but more just after this. Assalamu alaikum, very good evening, welcome back. We're commemorating World Hepatitis Day, celebrated on the 28th of July, and this conversation is getting more interesting. We have nephrologist and studio Dr. Wadi, who is really taking us through like a real teaching lesson, as well as our liver specialist, hepatologist. I'm so getting used to liver. So this is what we need to understand about hepatitis, A, B, C, D, E. So far. We've gone through A, we've gone through B, we want to get through to C, but understanding that it is an attack of virus on the liver, and it does cause cancer. It can be spread quite easily, not knowing that you can even be a carrier and living with it, walking around and giving other people the disease in a stronger form. So let's add on.
Some of the two things maybe that we should just, to do wrap up hepatitis B, is that, and we mentioned it before, it can be prevented.
Okay.
So you can prevent it by
So
vaccination.
A is the...
A can be prevented by vaccination and by good food hygiene.
Okay.
Hand washing, making sure your food is clean, not eating out, cooking your food thoroughly. I'm not sure how well cooking gets rid of the hepatitis A virus, but it's the same things which prevent other diseases spread by the oral route. Hepatitis B is similar to HIV, single partner, monogamous relationship, avoiding multiple sexual partners, avoiding blood transfusions. But the blood in South Africa is, I think, it's probably unheard of to get hepatitis B now. And then obviously from mother to child, to prevent that, the vaccination and the treatment of the mothers while they're pregnant and so forth and so on.
Can I just say, just in terms of stigma around hepatitis B, although it is also sexually transmitted and so on, in South Africa, one of the main mechanisms of transmission is still mother to child.
Yes.
And
therefore, you get it from your mum.
If you have, or at least a family member when you were young, in terms of chronic hepatitis B. Now, if diagnosed, the rest of the family should also be screened for viral hepatitis B.
Okay.
All right, firstly. Secondly, we do currently have very effective treatment to control the hepatitis B. Unfortunately, we don't have drugs to necessarily cure hepatitis B. Inshallah, that is on the horizon. There's a lot of research being focused in on that, but at the moment we don't. At the moment, we can prevent complication and we can improve function by keeping the hepatitis B virus suppressed, stop it from replicating, but it lies dormant. As soon as you go off the treatment, it'll rise up again.
Okay, so we want to talk more about the management a little bit later on.
Okay. No, well, we can finish maybe up with hepatitis B. because the only other aspects, as Bilal mentioned, so hepatitis B causes, besides liver cancer, it also causes cirrhosis of the liver, or destruction of the liver gradually over time, you know.
Okay.
And that can lead to complete liver failure. So the treatment may help to prevent that as well. And then obviously if the liver fails, like with other forms of liver failure, then you need to look at liver transplant.
So do we now move on to hepatitis C?
Let's do that.
And then also just add on, you know, who is at risk for hepatitis? Or do you want to leave that as a general?
For hepatitis, there's one last thing I want to say
Okay.
about hepatitis B, and that is the risk of cancer in terms of screening. If you know you have hepatitis B, it is crucially important that you get screened for liver cancer. Once liver cancer grows to a certain point, there's very little that can be done for it. If it is still small when it is detected, there's quite a bit that we can do. So if you know you have hepatitis B, you need ideally every 6 months a blood test and an ultrasound of the abdomen.
Is that the screening process?
That's the screening
Because if you
process.
find it and it's very small, you can remove it. But if you find it and it's very big, it will remove you. So that's the problem.
Is that the same way it's diagnosed?
Yes, usually.
That official blood test and ultrasound? Okay.
Yeah, look, hepatitis B, although these are, and it's not only true for hepatitis B, but for hepatitis C as well. It's not only a virus that causes problems in the liver. It's a systemic virus, so it does cause problems elsewhere. For example, importantly, the kidney, which is the most important organ in the body.
Yeah, the most beautiful part of the world.
why
One of the most beautiful organs in the body. And we'll stop there.
Okay.
Hep C.
So hepatitis C is now a very interesting virus.
Okay.
Back when Shuaib was at medical school and they called it non-A, non-B.
Ages ago, yeah.
Ages ago,
Yeah.
right? Non-A, non-B, right? And subsequently decided to call it Hep C. It was only in about 1992 that they actually managed
Named
to
it.
identify the virus and cleverly name it hepatitis C.
And change from non-A, non-B.
This is important. So what was happening? People were getting an illness which looked like hepatitis B, for example. But they couldn't identify hepatitis B and they couldn't find hepatitis A. So they thought
what
it's
changed?
a new virus.
Yeah.
And they couldn't find this virus.
Okay.
So only in 1992, as Bilal mentions, they managed to identify the virus. And the majority of cases at that time were thought to be spread through blood transfusion. It was very important because if you have a virus you don't know about that's in the blood supply, how do you screen the blood supply? You understand? So it was critically important for them to identify this virus, for us to be able to screen blood and exclude blood of people who have hepatitis C, which now they can do quite easily. But that's always a risk with blood transfusions, you know?
But blood is screened now.
Yeah,
Yes.
absolutely.
Okay.
So as of 1992, and this is now important because if you received a blood transfusion, let's say in the up to mid 90s and in the 80s or 70s, even 60s, and you have general feelings of being unwell or something, you should be screened for hepatitis C. It's one of the tests that they recommend for individuals, in the baby boomer era.
Okay, so let's just go through this again. You're saying generally unwell. What does that mean?
So hepatitis C now is very vague and non-specific. Hepatitis C doesn't really present with the features that I discussed now
Like
in
acute
terms of
hepatitis.
yes.
Okay.
Right. Hepatitis C often worsens thyroid function, worsens diabetic control.
And it's a very systemic condition, that's true.
Causes just general aches and pains and feeling of unwellness. And only at a late stage, often is it identified once there's already cirrhosis or chronic liver disease, that which features are then manifested.
Well, it's been linked to diabetes, it's been linked to kidney disease. So hepatitis C has been linked to a lot of conditions.
Yeah.
Okay, this does also sound similar to a immune disease as well, like lupus or something. Generally
Yes.
unwell,
Yes,
tired.
true.
There's a lot of confusion of
Yeah.
diagnosis. and stuff.
Hepatitis C can actually induce other forms of immune disorders because of the way it manipulates the immune system.
Okay.
So even an autoimmune hepatitis, as I mentioned, like a lupus type picture in the liver, that's caused by actually hepatitis C. So hepatitis C is quite quite
He did,
yeah, it's something that needs to be looked for, and in individuals with a history of exposure. So if you've received a blood transfusion, if you're like a hemophiliac that was receiving product in the 1980s, these are individuals that should be screened. If you were in a car accident or had a difficult labor with multiple blood products, you should be screened for
I think
hepatitis.
a lot of people did receive blood products, and as we mentioned, we were not clear what was in the blood at that time. But that was the one way of getting hepatitis C. Now there's ongoing contraction of hepatitis C.
Yeah.
Through?
So this is often through intravenous drug use. This is the up and coming
modern day problem.
Yeah, source of spread.
Which is not rare.
Yeah. Sharing of needles is a big problem. Sexual transmission is less common with viral hepatitis C. Men who have sex with men, it is a documented method there, but from heterosexual intercourse, less so.
And this would be still falling under something that cannot be cured, this Hep C?
So this is
breaking news.
Yeah, this is now, hepatitis C is one of the modern day medical miracles. It was identified in 1992, and within 30 years, we've managed to come up with a 3-month and sometimes even 2-month course of therapy that has a 95% cure rate.
So that means it's gone after that for those patients.
Over that course,
back.
like TB, a course of medication,
Yes.
strictly
Course
followed.
of medication, you strictly follow it, and 95% we can assure you of cure at the end of that.
You can't detect the virus in the bloodstream.
And Hep C, is it also transferable? Same way you able to get Hep B?
That's what I was mentioning. It's not exactly the same as Hep B.
Okay.
Sexual transmission is different. It's lesser.
Sorry, yes, I must.
It's mostly IV drug abuse and through blood
That's
products,
right,
which obviously we've cleaned up the blood now.
Yeah.
But there are areas in the world where hepatitis C is also endemic. That means there's a substantial percentage of the population living and walking around with hepatitis C for a variety of reasons. There's a link with hepatitis C, for example, and bilharzia. So it's very common in Egypt, for example. And
so how, that big question is, how is it that people with hepatitis A, B, C walking it down and they're fine?
it's chronic.
So they get sick and then
you can have an acute illness and a chronic illness. The chronic illness, the patient recovers and goes on with their life, but may not.
But are they diagnosed with hepatitis?
Sometimes not, and probably in South Africa, mostly not.
They go on with their life and carry on as per normal, but there's a slow grumble happening in the background. Yeah.
So hepatitis is not like HIV. You get, so in some ways it is. For example, HIV, you get the illness, you get an acute illness, and then it goes into a latent period, which can be years, up to 10 years. So you don't feel anything. That's why HIV spreads in that period. The person who has HIV doesn't feel sick at all. They feel 100% normal. It's only as the HIV starts reactivating, getting more active after that latent period, they get extremely sick. And in the past, you would die. But now, obviously, with treatment available, they can be treated and the virus can be controlled. And basically, they're maintained in that almost a latent type period.
So let's understand hepatitis C is not one of those hep that gives cancer, that causes cancer. It does, okay. But in its late stage and being diagnosed, medicated, and hopefully get to that 90%, is it possible?
So maybe you can sum that up.
So with hepatitis C itself, it doesn't cause cancer like hepatitis B does. It isn't exactly an oncovirus in the liver. What it does is that it causes chronic inflammation. And just like if you get a regular sunburn, you can get skin cancer, it's a similar sunburn effect on the liver. Regular inflammation, regular damage can then result in cancer. So yes, hepatitis C, chronic hepatitis C can also cause cancer.
Okay. When we get back, I still want to touch on who is more at risk besides, history of liver disease. We want to still unpack that. So much questions now is popping up besides those that I have with my producer. But we'll talk more hepatitis just after this. Assalamu alaikum and welcome back to Health Matters. I'm Khawa Sanam in our last few minutes of hepatitis, World Hepatitis Day, and really unpacking. They've just, I think, done quarter part of the alphabet, Hep, A, B, C, D, E. Hopefully there will be profound enlightenment when it comes to not expanding on the rest of the alphabet, inshallah. But we have our specialist in studio, nephrologist and hepatologist, Dr. Wadi and Dr. Bilal. Shukran so much for your time. This has definitely been interesting for me. And I'm so glad that we've sort of put aside the listeners' questions, the viewers' questions, because there'd be so much coming in now. But alhamdulillah, we need to just get through informing people and highlighting World Hepatitis Day. So we need to wrap up on Hep C, and then we're going to talk about what is it? Vaccines. We want to still mention who is at risk. So D and E, how common are they? But let's quickly wrap up C.
So hepatitis C, you don't really get an acute illness. It's a bit of a flu-like illness. Some people may notice jaundice, but then quickly settle.
Okay.
The problem is that unlike with hepatitis B contracted as an adult, the vast majority of patients who contract hepatitis C end up with chronic hepatitis C. The body finds it difficult to fully clear the hepatitis C, and that can linger for a long time. The good news is that there is treatment available. The treatment is accessible, right? Unfortunately, we don't have it necessarily on the shelf in South Africa. There's a bit of a process to go through in terms of getting it. It's done on a special import on a named patient basis.
It's not registered yet for a variety of reasons. Yeah.
In SA.
So, but we can access it, and we have been having excellent success in terms of treating patients with hepatitis C at our unit.
And availability, is it specifically government and both private and government?
The system would be the same.
Okay.
Yeah.
But someone needs to pay for it.
The costs has come down significantly.
Okay.
All right. So in terms of when it was first launched, it was $1,000 per pill. It's now down for the entire course would be 10,000 Rand for the 3-month course.
Sure.
Which is
That's still
a drop in the ocean compared to what the condition would cost if allowed to progress. So and what it costs, and it's a once-off.
And it's a once-off. Yeah.
It's not something you take.
So
for 10 years.
So is it also that 95%?
Yeah.
Okay.
That's the one.
All right.
Right.
The vast majority. Hepatitis C does need to be looked at a bit closely. There are different subtypes of hepatitis C. Some drugs work better with different types.
Okay.
So that's where the specialist would need to come in and have a look.
And obviously, if you've had severe organ damage from the hepatitis C, that's not going to reverse. So if it's, for example, destroyed your kidneys and given you kidney failure, that's not going to get better. If it's destroyed your liver completely, it's not going to get better. You would need a liver transplant or a kidney transplant.
So 90% of your liver is gone, and
so that's why you should be screened while you're still well.
If you get to a point where the damage is irreparable, that's true. But if you manage to catch the hepatitis C, when there's still damage in the liver, you can actually, with removing that insult, in time the liver can recover.
so it can get better.
The liver's got a lot of powers that other organs don't have.
Diminishes the bit of the kidney issues, eh? Won't get into that.
It can get a bit better,
Okay.
yes.
So livers can be a bit stronger than
There's much more liver tissue than kidney.
Okay, so now I know the real story. What's A, B, C, D, and E?
So hepatitis D,
yeah.
occurs in conjunction with hepatitis B. You need hepatitis B. Hepatitis D is a bit of a, it's almost like a sidecar on a motorbike.
It's like a plug-in for an app.
Yeah.
So you can,
It won't work on its own.
It won't work on its own. It's got no engine to drive replication
Hep B would
itself.
be visible.
So you need
It uses the
Hep B
machinery of Hep B,
in order to have the hepatitis D as well.
Okay.
Now, thankfully, we don't have much hepatitis D in South Africa. There's quite a bit of it in Asia, though, right? So, individuals that have come from South Africa, from Asia, and their hepatitis B is severe and difficult to control, we need to screen for hepatitis D, and the way you treat it is by
I mean, we need to
controlling
change
B.
our country so
Controlling
that
B,
we
okay.
have more A's in education than in health, you know, and more. So then we'll be winning.
E.
Hepatitis E is a bit of an up-and-coming virus in terms of its noticeability. All right, it's quite
Is it
well
standalone?
established. It is standalone. It's got its own letter. It's well established in northern parts of Africa,
Okay.
and then again Pakistan, India and Bangladesh, where the specific genotype or subtype of hepatitis E can cause outbreaks,
Okay.
which can be severe enough to lead to liver failure, similar and is spread similar to hepatitis A. Unfortunately, there's no real vaccine against hepatitis E. In South Africa, where we don't have these subtypes prevalent here. We still have hepatitis E, but it's a milder form, and it's genotypes that are associated with eating undercooked meat.
So all of, I mean, from C, I think, and all of it, A, B, C, D, E, is still currently being studied and tested.
All of them.
And hopefully we'll stop with E. Am I right?
Well, there are other viruses that have been discovered and
EFG.
documented to cause
Okay.
liver hepatitis.
Yeah.
Epstein-Barr virus, the virus that causes infectious mononucleosis, for instance, or glandular fever, that can give quite a significant hepatitis. There's something called cytomegalovirus, generally occurs in immunocompromised individuals. That can cause a hepatitis. A very severe form of hepatitis would be herpes, induced herpes simplex virus.
Okay.
That
And these all
has-
affect the livers.
and these can affect the liver, and that can have quite a herpes simplex hepatitis can be very, very severe.
Dr. Wadi, risks. Who else is it just besides
Some of
those?
the biggest two risk groups in South Africa in terms of hepatitis B would be healthcare workers. So you're working with body fluids, whether it's in the lab, whether it's clinically, whether it's in a dialysis unit, whether you're a surgeon. And as we mentioned, hepatitis B is highly infectious. So in fact, it's recommended that all healthcare workers be vaccinated and have regular boosters. So hepatitis B, your immunity can wane
Okay.
or can decrease after some years. So you're meant to check it every couple of years. And then if your hepatitis, in fact, probably every year, but if your hepatitis B immunity has waned, you should have a booster. The other group would be sex workers in South Africa. Similar to HIV, obviously they would be exposed. It is a sexually transmitted virus. And then the third one, as Bilal mentioned, would be in creches, especially in endemic areas.
Okay.
So that can only really be prevented with vaccination. There's not much else we can do for those. In fact, all of them can be prevented with vaccination.
We've got 2 minutes left. Wrap up vaccines. What vaccines are available for hepatitis?
So there's the combination vaccine for hepatitis A and B that is available. Hepatitis A is not on your immunization protocol in South Africa and is a vaccine that I would strongly recommend that people look at either paying out of pocket or via your medical aid to receive, especially for your kids growing up. Hepatitis B is on the vaccine protocol.
Okay.
All South Africans should have received it at some point.
But there's
Some that
obviously
don't.
some that have missed
Yeah.
for a variety of reasons.
I know this is a question on its own, but what would happen if you don't get vaccinated? Under our vaccinated sort of question mark, not being vaccinated.
You mean just for hepatitis B? You could be at risk of getting hepatitis B.
Yeah.
It's like any other virus. So the vaccine reduces your risk. And in fact, if you are properly vaccinated and you develop immunity, it should eliminate the risk. With hepatitis B, obviously, there is a risk of waning immunity. Your immunity can decrease with
Okay.
time.
Management in our 30 seconds that we have left.
Hepatitis A, supportive management. It's generally mild. patients often have a bit of diarrhea, vomiting. Make sure that their electrolytes and fluid status is managed. Hepatitis B, acute hepatitis B is again generally supportive. Most people clear the virus with their own immune systems and then don't need anything further. For those with chronic hepatitis B, there is adequate therapy to prevent complications. It's important for those people to be screened for liver cancer on an annual basis. For hepatitis C, there is now effective treatment that is accessible and should, if you are aware of your hepatitis C status, try and access it.
Dr. Wadi, 10 seconds to wrap up. Your last words.
I think we've learned a lot about hepatitis today, and inshallah, it's just one of a whole variety of diseases which can affect an individual. So I don't think everybody needs to go out and rush to have the hepatitis checked, but there are groups of people out there who may benefit from having a blood test to look to see if they may have contracted hepatitis, particularly B and C at some time in the past, and those groups should go and have themselves. And
like you said, you could possibly even just be a carrier. So
absolutely.
Thank you so much, Shukran, for your time, Dr. Wadi and Dr. Bidal. Really informative, and this has just really shook my understanding of looking at hepatitis in a different light for you as well, I'm sure. So go and Google it, find as much information as you can, and if you need any of these, what was said this evening is recognized in your family, and you can relate, go and have yourself screened and tested, blood test and an ultrasound at your local GP and possibly at the specialist. From myself, Hawa Solomon, for now. Next week, catch our show, Health Matters, and remember any of the shows that you have missed on YouTube. Wassalamu alaikum and goodbye for now.